6 months ago, she weighed 220 pounds. Today, she weighs 163. No diet, no surgery, no exercise. Just one injection, once a week. Her name is Linda. She's 58 years old, and she says it completely changed her life. But here's what Linda's doctor never told her. In those same 6 months, Linda lost 12 pounds of pure muscle. Her bone density dropped. Her metabolism slowed down so severely that the moment she stops the injection, and she will have to stop it eventually, she will gain back every single pound, possibly more. And there's something else. Something the pharmaceutical companies don't want you to know. Something that affects Americans over 50 specifically, in a way that is completely different from everyone else. Today, we are pulling back the curtain on Ozempic. The real science, the real risks, the real results. And by the end of this video, you will know exactly whether this drug could help you or quietly destroy your health. Stay until the end, because what we reveal at minute 13 has already changed the decision of thousands of Americans over 50. Welcome to ClearMed Life, where we give Americans over 50 clear, honest, science-based health information with no hidden agenda and no pharmaceutical sponsorship. Today's topic is one of the most requested subjects we have ever received. Ozempic. Let's get into it. First, let's talk about what Ozempic actually is. Because most people have no idea. They see the commercials. They hear the celebrity stories. They see the before and after photos on social media. But they don't actually understand what this drug does inside their body. Ozempic's real name is semaglutide. It was developed by a Danish pharmaceutical company called Novo Nordisk, and it was approved by the FDA in December 2017, not as a weight loss drug, but as a treatment for type 2 diabetes. Let that sink in for a moment. Ozempic is a diabetes medication. The fact that millions of Americans are now taking it primarily to lose weight is what doctors call off-label use, meaning it was never officially approved for that purpose. The drug that has taken over America's medicine cabinets was designed for a completely different condition. So how does it work? Ozempic belongs to a class of drugs called GLP-1 receptor agonists. GLP-1 is a natural hormone your intestines release after you eat. It signals your brain that you're full, it slows digestion, and it tells your pancreas to release insulin when blood sugar rises. Ozempic is essentially a lab-engineered version of that hormone, but with one crucial difference. Your natural GLP-1 disappears from your body within minutes. Ozempic was chemically modified to resist breakdown and stay active in your body for an entire week from a single injection. It works in 4 places simultaneously. In your brain, it crosses the blood-brain barrier and directly affects the appetite control centers. It turns off hunger signals and turns on fullness signals. People who take it describe the disappearance of what scientists call food noise, the constant background thoughts about food, cravings, and eating that most overweight people experience all day long. For many people, this is the first time in their lives that food simply stops occupying their thoughts. In your stomach, it dramatically slows down the rate at which your stomach empties. Food that would normally leave your stomach in 2 to 3 hours stays there for 6, 7, 8 hours. This sends constant mechanical signals to your brain that your stomach is full, even when you've eaten very little. Most people on Ozempic naturally eat 30 to 40% fewer calories, without feeling deprived, without white-knuckling hunger, and without counting a single calorie. In your pancreas, it works intelligently. When your blood sugar is high, it triggers insulin release. When your blood sugar is normal, it does not trigger additional insulin. This is why, unlike older diabetes medications, Ozempic rarely causes dangerous blood sugar crashes. In your liver, it suppresses a hormone called glucagon, which is responsible for telling your liver to dump stored sugar into your bloodstream. The result of all 4 mechanisms working together? Studies show an average loss of 15% of total body weight over 68 weeks. For someone weighing 220 pounds, that's 33 pounds. That is genuinely significant. But now, And this is where the video gets critically important. Let's talk about what happens to Americans over 50 specifically, because the risks are not the same for everyone. Starting at around age 40, the human body naturally begins losing muscle mass at a rate of 3 to 8% per decade. By age 50, this process accelerates. By age 60, many people have already lost a significant portion of the muscle they had at 30. This condition has a name. It's called sarcopenia, and it is one of the most serious and underappreciated health threats facing older Americans. Now, add rapid weight loss from Ozempic on top of an already declining muscle mass. Studies show that people taking GLP-1 medications like Ozempic lose approximately 25 to 40% of their total weight loss from lean muscle mass, not fat. For a younger person, losing muscle mass is concerning but recoverable. For someone over 50, it can be devastating. Loss of muscle mass after 50 directly increases your risk of falls and fractures. It slows your metabolism. It weakens your heart. It reduces your ability to perform basic daily activities. And it significantly increases your risk of disability as you age. There is also a phenomenon that has become so common it now has its own name. Ozempic Face. The rapid loss of fat, including the fat that gives your face its youthful fullness, causes the skin to sag, the eyes to appear sunken, and wrinkles to deepen dramatically. Many patients report that while their body looks smaller, their face looks years older virtually overnight. Now, let's talk about the side effects. The gastrointestinal side effects are the most common, and for many people, the most difficult to tolerate. Nausea and vomiting typically occur in the first 2 days after each injection, and worsen significantly every time the dose is increased. Severe constipation is extremely common, caused by the dramatic slowdown of intestinal movement. And then there are sulfur burps, a phenomenon where gas released from the mouth carries the smell of rotten eggs. This occurs because food sitting in the stomach for extended hours begins to ferment. There is also profound fatigue, particularly in the early weeks. When your caloric intake drops suddenly and dramatically, your body has significantly less fuel. Beyond the gastrointestinal effects, there are more serious risks. Acute pancreatitis, sudden, severe inflammation of the pancreas, is a known risk. It presents as intense abdominal pain radiating to the back with persistent vomiting. It requires immediate hospitalization. Gastroparesis, complete paralysis of the stomach muscles, has been reported. The stomach stops moving entirely. Food cannot be digested or emptied. Acute kidney failure, occurring through severe dehydration caused by vomiting and diarrhea. The medication suppresses the sensation of thirst. Without deliberate hydration, this creates a dangerous situation that can shut down the kidneys. If you experience intense abdominal pain, persistent vomiting, or continuous nausea, do not wait. Go to the emergency room immediately. And there is one absolute contraindication every American over 50 must know. If you or anyone in your immediate family has ever been diagnosed with medullary thyroid carcinoma or multiple endocrine neoplasia type 2, Ozempic is completely and permanently off limits. Now, the question that every American over 50 is really asking: does the weight stay off? The honest answer is, for most people, no. Clinical trials showed that patients who stopped taking Ozempic after 1 year regained an average of 67%, 2/3 of the weight they had lost, within just 12 months of stopping. The reason is biological. Ozempic does not fix the root causes of weight gain. The moment it leaves your body, your stomach empties at its original speed. Your hunger hormones return, and often come back stronger than before, flooding your brain with food cravings that feel more intense than anything you experienced before you started the drug. If you have not fundamentally changed your eating behaviors and built sustainable habits during the time you were on the medication, the weight will return. Guaranteed. So what is the right approach to Ozempic for Americans over 50? Step 1. Talk to your doctor about a full evaluation first. Ozempic is a serious prescription medication. It requires proper medical assessment, baseline blood work, and ongoing monitoring. Step 2. Prioritize protein above everything else. Because your appetite will be dramatically suppressed, the small amount of food you do eat must be protein-dense. Chicken, fish, eggs, lean beef, Greek yogurt. Every meal. Without adequate protein, you will lose muscle, not fat. Step 3. Resistance training is not optional. It is mandatory. You must work to preserve and build muscle while on this medication. Without this, you are trading your long-term health for short-term weight loss. Step 4. Drink 3 liters of water every single day. The medication suppresses thirst. Without deliberate, consistent hydration, the risk of kidney damage and severe constipation increases dramatically. Step 5. Have a plan for after. Before you ever take your first injection, discuss with your doctor how and when you will eventually transition off this medication. Now, let's talk about the alternatives. Wegovy contains the exact same active ingredient as Ozempic, semaglutide, but at a higher dose. It is the version officially FDA approved specifically for weight loss. Mounjaro and Rebound contain a different compound entirely, tirzepatide, which works on 2 hormonal pathways instead of 1. Many physicians consider it more powerful than Ozempic. Maximum dose reaches 15 milligrams weekly. And Rybelsus, the same semaglutide as Ozempic, but in daily oral pill form rather than weekly injections. For those who are afraid of needles, it offers the same mechanism with somewhat lower effectiveness for weight loss. Let's bring it all together. Ozempic is a genuinely powerful medication with real, documented benefits, particularly for Americans with type 2 diabetes and significant cardiovascular risk. For weight loss, it works. The results are real, but it is not magic. It is not permanent. And for Americans over 50, it carries specific risks around muscle loss, bone density, and metabolic health that requires serious attention. The decision to take Ozempic should never be made based on a celebrity endorsement, a social media trend, or a television commercial. It should be made in partnership with a doctor who knows your complete health history, with clear eyes about both the benefits and the risks. You deserve that level of care. You deserve honest information. If this video gave you something useful today, please hit the like button. Subscribe to ClearMed Life. New videos every week. Designed specifically for people over 50 who refuse to settle for less than the truth about their health. Better health, better aging, better life. We will see you in the next one. Take care of yourself.